The Knee Gurus, the latest research and advice from industry experts for best practice management on knee injuries and pain. Here's your host, Bevan Colless.
Welcome back to the Knee Gurus. I'm your host, Bevan Colless, and we're here to speak with the experts in knees right across the world to help you make an informed decision on the best management for your knee. We've been really fortunate to speak with many experts across the world. And if you haven't had a chance, I'd highly recommend going back and listening to our last episode with Stephanie Philbay, who is one of the world's preeminent researchers on ACL management. And she discusses the cross-bracing protocol and evidence-based management of ACL. And I think you'll find that episode really interesting and helpful. But in this episode, we're really excited to speak with another expert on ACL, Jess Cunningham. Jess is a titled sports and exercise physiotherapist, and she has worked extensively in snow sports throughout her career. She's toured Australia, New Zealand, and toured with national teams. She's worked for many seasons in Wanaka in New Zealand, seeing snow sports injuries every day, and she's travelled worldwide with elite snow sports athletes to X Games, World Cups, World Championships, as well as the 2014 Sochi Winter Olympics as Australia's snowboard, halfpipe and ski slope style team physio. She's also worked with the Australian sailing team and held a role of movement specialist for the GWS Giants AFL team, and has also worked on the World Surfing League and WQS surfing tours in Hawaii. She's now a mother of 2-year-old twins, and she's operating Surf to Summit Physiotherapy from the Wollongong region in New South Wales, Australia. And you can find her clinic on the internet at surftosummitphysio.com. But Jess is probably best known as the author of an excellent ACL book called Pop, When Sport Brings Us to Our Knees. I thought the name Pop was really a terrific choice and very catchy and memorable. And the book's basically a collection of stories, mostly from elite athletes who've injured their ACL, and they talk us through the journey that they took, how it was managed. And the book probably focuses a little bit more on the emotional side of the journey of doing your ACL back to returning to sport. So Jess, thanks very much for coming on.
Thank you for having me.
Okay, so as a fellow snow sports physio like myself, you do get exposed to a lot of ACLs. Is this how you became interested in the ACL? And what do you think it is about the ACL that is so interesting, or that captures the imagination of so many people, more so than another common snow sport injury like a calf muscle tear or an Achilles rupture that both can have serious implications? Why the ACL?
I think that's in winter sports. I think for me, it's definitely as a physio, I like treating all areas of the body. But had you told me 10 years ago or however long ago that I would write a book on ACLs, I would have probably gone, no, I probably won't. But it turns out that I did. And I think that with winter sports, the knees follow you rather than me pursuing the knees. Because again, as you would know in your work, they're just so frequent in their occurrence when you're working, particularly as you are in a mountain area where you're seeing people as they're coming off the hills. Like, it's just such a common injury. So I think compared to any other work that I've done before in private practice in Australia, or working with football teams or things like that, where you still see those injuries, but just winter sports, they're just so frequent. And I was fortunate enough in New Zealand to work there in an era where there was a thing called Snow Park, which was a big terrain park where there was nowhere else in the Southern Hemisphere at that point in time for the world's best to come and train at that time of year. And it consisted of just a huge, it's closed now, it's opposite Cadrona on the other side of the valley. But it was just a massive terrain park when terrain parks were kind of just starting, and it had a great half pipe. But everybody in the world who was anything in winter sports in those events would come and train there. And my office space was a little hut at the bottom, so I would just look out the window and look up and just watch the ACLs happen.
So were you working
in real
inside a
time and
medical
watch them
centre?
get carted down, or so I worked as part of Monica Physiotherapy, which had a clinic inside or in Monica, and then we had little satellite clinics, one at Cadrona, and it was the same there. It's just that's a bigger mountain, so you can't see them happen all the time. And so we have a little satellite clinic up there and another one up at Snow Park. And Snow Park, you just had this vantage point of you would just see them. So there was us and the ski patrol, but they would come. You would be the first port of call, and often very quickly after they'd done it, and then you would have the privilege of following them up and going through their rehab in Wanaka if they were there, or packaging them off elsewhere. So you sort of got to see, if you're working in a normal clinic area that's not in an alpine environment, it's pretty rare that you see one that's that fresh. You might see them a few days later. So sort of just having, I guess at the time I didn't realise how unique that was, and then the more I kept working in winter sports through the elite, obviously you sort of see them. It's a bit of a rite of passage almost. Most athletes, I think that's maybe less these days as their training is getting better, but it's a pretty common injury that everyone's gone through at least once. The knees just kind of, I became surrounded by them all the time. And then when motherhood hit, I knew that I wouldn't be traveling and working in those areas for a little while. I kind of was like, oh, what can I? Discovered my brain wasn't quite content just sitting there during all of the breastfeeding and the sleeping times, and I, for some reason, thought it would be a good idea to put all of these unique stories, of which there are definitely a few in winter sports, but through my other connections of, it's not hard to find athletes that have injured their ACLs, but since it's such a long injury recovery, no matter sort of which method you go down, compared to a calf or something like that, it's usually much more traumatic for the person involved. And so I guess that, and also knowing that, there's so much research into it worldwide, it's kind of the sexiest sports injury, if that's a term you can say. There's, it's got interest in that topic from clinicians through to obviously through everyone and the general media. So that's sort of how my interest in it started inadvertently. Again, it sort of followed me, but then realised that actually I had some really unique experiences and contact to people that maybe that would be worth sharing.
Yeah, and so you've done a terrific job getting together a collection of really interesting people and stories. So who is the target market for the book? Who's buying it, and what feedback? What sort of people are you finding it really resonates with?
I think it's actually resonating quite across the board of both athletes or general people who have injured their ACL, or family members or friends of people that are caring for people that have, or know people that have, or maybe have done it themselves years ago, but also in the health professional area as well, of physios, doctors, surgeons, strength and conditioning coaches. So it's sort of, and researchers as well. So it's been quite amazing seeing the reach of it all. And I did initially think, people have often asked why did you choose to write a book rather than formal research? It's obvious it's quite a lengthy process, I found out, to write a book. And it's not maybe as formally recognised as, doing a more formal type of research. But I just figured there's so much research already out there, but so many people aren't aware of it. And your general population isn't really going to be reading that. The clinicians we get really excited about it, but general populations don't. So I sort of tried to come at it at a different angle, I guess, with a book, which is a bit more easily accessible for everybody. So that was kind of the premise for it. But as for a target market, it's tried to be quite broad, and it's turned out that that's been how it's been received, which is great.
Right. Yeah, it's very true. The general public, you can kind of see their eyes glaze over when you start talking about statistics and research, but if you start talking about anecdotes and people's real stories, you can tell that you really grab their attention, and that just seems to be human nature. So you probably and not many other people have well, no one I think has written a book like this, but as you say, lots of research out there, and a lot of it conflicting and confusing and as well. So can you give the readers a rough outline of the content and format of the book, and what you were sort of trying to focus on and bring to the readers?
Yeah, and I think, as you've said there, like in my own clinical practice, sort of always fallen back on anecdotes, and again over time realised that some of the experiences I'd had were quite unique. And when I'd talk about them for the right client, their eyes would light up, and you will have engaged them a lot more rather than reeling off stats that, again, as clinicians, would be going, "Oh, that's fascinating." They don't. It just doesn't hit their brain in the same way. So the way the book is laid out is knowing that if, again, stats are so important, and some of the research in this space definitely needs to be shared and made more aware. But if I made it more of a traditional research type academic writing, most of your general public would glaze over before they got through the introduction. So the introduction is quite short and does speak to the relevant research in this area, but in a very generalistic term. All your references are at the back there, but then it very quickly launches into the athlete stories, and they're the main chapters of the book. Each athlete, it's broken into two sections of them telling their story, basically, and then reflecting on that and what they learnt, what went well, what didn't go well, what would they change, offering advice, and things like that. So, and then at the end, there's a little bit of a summary chapter with some resources pointing people in the right directions of some of the injury prevention programs that are there, or a little bit of a checklist of things that they should be talking about with their providers of care, about questions that they should be asking and things like that. So it's definitely not meant to be a manual of how to rehab an ACL, but it's meant to be more of a conversation starter, I guess, of providing lots of different approaches to it, and some that went well, some that didn't go well, but of the general lessons that can be learned and principles that can be applied to for anyone going through it.
Yeah, and I suppose with all the acute ACLs that we see as on mountain snow sports physios, as you say, we're privileged to see people walk into the clinic on day 0, 1, 2, or 3 when the injury's really fresh. And I'm sure you've noticed one of the things that you find surprising or a little bit unusual is the huge range of presentation amongst patients with often the same injury. It might just be but it might be a normal ACL rupture with nothing else damaged in the knee, and one patient can come in hopping and completely reluctant to weight bear, and another person can walk in almost without a limp and say, my knee feels pretty good. I wasn't going to come in, but it just feels a little bit wobbly, and I saw the physio signs, so I thought I might come in, and lo and behold, you see that those two presentations have exactly the same injury. And I noticed there was a little bit of a theme with that in your book as well, in that some people, some of the athletes managed to sort of shrug off their ACL injury, and in the case of Mitch Sport, who we had on the podcast, actually was able to play a couple of weeks after his ACL and have it heal and pretty much continue his life as though it never happened, whereas other people, it can be a lot more devastating. Why do you see that huge? Why do you think we see that huge range in the way the same injury can affect different people? Do you think it's physiological or psychological or a combination of both?
I think that it can be a combination of both, and I do think that the research that's coming out that Steph would have spoken about, I haven't listened to the podcast she did with you, but the most recent one, but I'm assuming I know much of what she's going to say. I think the categorization that Tom Cross is sort of developing of the different types of, we just go, you've ruptured your ACL, end of story.
Yes, I know. Yeah.
I think that now that most likely, and if you chat to him about, Mitch is in the book as well, and you've heard his story from your podcasts too. And if you talk to Tom, his was more of that mid-substance, like that sausage, like he still was intact around the mid-substance was gone, and it's healed in the envelope was sort of still there, which you kind of go, well, that's probably why it didn't swell that much. So I think that really, like most things in the body, it's not mysterious. It's just that we potentially in the past, we just put the one diagnosis, which is the umbrella, on top of what can be a very varying, different, we rate everything else of grade 1, to it's not just grades, but yeah, what exactly, where did it tear, how did it tear, what else is going on, probably correlates. But then there is probably a factor of how strong is that person too. And I think also their past experience of so many people historically have, again, because that's been the narrative that we've run with for forever now. I've done my ACL, that's it, it's catastrophic. I know other people that have done it, I have to have surgery. If that's your mindset from the start, you might not present as well as someone. And Russ Henshaw's story in the book is a good example of this, that he knew of other athletes that had survived without theirs through sort of the Scandinavian, Norwegian sort of program, and they're quite ahead in this area, I guess. So he sort of already had a, hang on a sec, no, I'm actually presenting okay, and I know that this can be done. So his thought process was different from somebody else that, again, had maybe gone down that no, surgery must be what's there. So I think it's probably a combination of all of those things that can be varied in presentation. But again, I think the most exciting thing at the moment is that sort of the classification that Tom's kind of starting to come out with, again, which ones are more likely to heal is what he's coming out with, it, which is really exciting. But also that probably does explain the ones that we see that how they vary so much too in their physiology, because it probably depends on what that internal physiology is doing.
Yep. Yeah, it's funny. It was just one of the things we were talking about with Steph on the last podcast was how much we've gotten wrong with ACL injuries, in the past, and I'm sure you've had the blurb in your head, like an MP3 file that just comes out of your mouth when you're talking to somebody who's done a new ACL injury because you've delivered it so many times. But I know mine has certainly changed a lot over the last 5 years, and we need to keep updated with the changing management. But it just seems certainly as far as the complete rupture or no, or it being fine, as we've gotten that pretty wrong, as well as a myriad of different things. But one of the things you mentioned there was about the catastrophizing of ACL and that terrible sort of dark cloud that comes with the word and with the diagnosis. And I'm sure you've seen many people in your treatment table, fall into tears as soon as you mention the ACL. But some people are have it a little bit more of a less negative view, or think maybe that they can manage it a little bit more easily. Where do you think that this catastrophizing of the ACL comes from, and why do you think that there is this really negative connotation with ACL injuries?
I think that again it can vary a little bit, but part of it is just that historically, and again, if we're all running off that narrative of you've ruptured your ACL, then unless if you want to do anything fun in your life ever again, here's it basically a year, major surgery and a year of your life spent rehabbing it. If you don't even need to be an elite athlete, but elite athlete, there's your job, there's potentially your contracts, there's potentially your career, really interfered with or gone. And for just anyone, that's a very big upheaval in your life. And we all know the amount of rehab that is actually involved to get back from that is a lot more than a lot of people think anyway. But I think there's also that people might have been through it before, because re-rupture rates are pretty high, so it's pretty devastating to go, oh my goodness, I have to go through that again. Or they know someone else that's done it and have seen their journey and gone, God, that's me now. So I think all of those factors, depending on where that person's come from, and potentially the way we've delivered it as well too, of, well, that's it. You won't be, that's the wording, all of those things combined. But again, I think now that the research is obviously still always a way to go with everything, but that, and for physios, it's so important because we are often that first port of call, and I think the surgeons, that the conversations are starting to shift a little bit. So whereas before, you often, if you're the only person saying that conversation, it's very hard to get your patient to believe you almost, or to be on board, because they're like, but everyone else has said something different. Whereas now, and again, that sort of was one of the things in POP, that it was just like, at least that's sort of a resource that, again, it's not right or wrong, there's nothing there, but here's a variety of experiences that you can kind of choose where you want to sit in that. Because again, I think the surgery is great for many people. It's a fantastic option. So it's not to say that that's not the case. It's just that there's also potentially other ways to do it too. And again, just looking at that whole picture, which maybe we haven't been that great in the past. And that's part of the benefit of having our healthcare system be as good as it is, that it's been, whether purposefully or not, but, sort of streamlined to facilitate having those surgeries. So that's part of our luck of where we live in the world too.
Yeah. And one of the things I found really interesting in your book was the psychological aspect of ACL, of the, going through the journey of rupturing an ACL, where a lot of the athletes talk quite in depth about their emotions at the time of injury and during their rehab and on their return to sport. That's often not talked about a lot. What do you how important do you think the psychological aspect of ACL injuries is, and do you recommend people see a sports psychologist, or what advice would you give people for coping with that side of doing an ACL?
I think that, and that is a reason that I again focused on that, because I don't think anyone can get through again such a long rehab that's so disruptive to your life without having some dips, and that's if it goes well, and often things don't go as well as you'd like, or there's hurdles along the way. So all of those stories, probably the Nathan Walker's, the ice hockey, which is I think the last one, is probably the smoothest run. And I didn't set out in the book to find bumpy journeys. I tried to set out to find the biggest variety of athletes from different sports, to have the widest reach with different graft types and different things. But when sometimes you start reading, you're like, these are pretty harrowing, but that wasn't my intent. It's just that so many of these people it's so common for it to be a pretty harrowing existence for a while, because it's hard. And I think that
athletes.
Yeah, and these are professional athletes. So that's been, some people have been like, why did you interview professional athletes rather than just the general? Professional athletes have all the services there. And I think when you read the book, you'll also realise that's not always the case. That we often think that they're getting better support than they are, or, for a myriad of reasons. Sometimes the support's excellent, but there's just other factors at play as well. But I chose the elite athletes as more of a filtering from top down. I figured people were probably more likely to read stories like that. But yeah, back to your original question. I think that the psychology is so important, and not everybody wants to see a sports psych. And I don't think that for your average weekend warrior or person that's necessarily the path. But I do think, and again, a book like this is having a whole lot of those conversations in your pocket. But the internet, like social media, is so great. There's so many ACL support groups out there now on Facebook or Instagram or wherever, that you can actually access it like anything. Like, newborn mums get put in mothers groups because everyone else forgets it because it was so traumatic at the time. But, you need to be with people that are going through it at the same time. And I think that's really helpful if you can achieve that. And again, if you can't, often physio clinics now will have an ACL rehab group that are going through together, or a lot of sort of, some of the bigger strength and conditioning kind of performance gyms will have those ACL kind of, I want to say class, but rehab groups that work through together, because it's just so helpful to have other people in the same boat rather than it's a long rehab to do on your own. But yeah, if you can't find it in person, again, the internet is a big wild place these days that you can definitely tap in and have conversations with other people experiencing the same thing. So I think that's really valuable. With the disclaimer of comparing to others can always be tricky sometimes, and your journey will be different to theirs, so as to not always think that, hey, well, they're doing that now. Like, you have to sort of take it with a bit of a grain of salt. But having that support, the psychological support around you of other people that will understand it, I think is really something that's should be considered when we are doing these rehab programs, of like, what's your rehab going to look like? What facilities are nearby? What is that support structure? How do we make sure that you are supported in all facets, not just physically and medically, but yeah, what might be just friends and family, or can we suggest, again, some other resources that they could potentially utilise as well?
Yep. Yeah, there are a lot of Facebook support groups, and some of the stories you can hear can often be pretty scary, but there are also a lot of uplifting stories there as well. And as you say, there's not everybody wants to reach out to a sports psychologist, and as a physio, part of your job is being a psychologist, and people
absolutely
don't always bond with a psychologist, but they often develop a close bond with their physiotherapist. So that, as you mentioned, the way that we phrase things and present outcomes and project is really, really important too for the physios out there as well.
Absolutely. I think, as physios, we are we're most like, and again, this does depend when you go onto those online forums, you realize how different healthcare systems are around the world too, and that the way we rehab here, I think Australia, we're doing pretty well on the world front, is not always the case. So again, the internet, like with everything internet related, take it with a grain of salt. But it can be powerful. But your immediate provider, which is usually a physio, is we have a huge role to play there.
Yeah, and since writing or researching and writing the book, and with all the new evidence that's come out over the last couple of years, has it changed the way you think about ACLs or the way you manage patients with ACLs at all? And
I think it's really exciting when you chat to like Steph and Tom, and obviously there's more. I think for me it hasn't necessarily changed how I treat ACLs, but it has clarified, like we were saying, with the presentation types, what and why and how certain things are presenting, and how we can treat it. And I think, there's still so much more research to come out of it, but it's just such an exciting time, I think. But again, knowing that whole spectrum that there is, surgery versus conservative, I don't think that should be a debate between the two sides, because again, we need all the tools in our toolkit. But there will have to be a second edition of POP, which is fine when we get the time to do that, but it will be great to have. And again, so there are conservative. At the moment, POP doesn't talk about ACL healing, because when it was written, the research for that was really pretty much just out there. But again, Mitch Short's ACL has healed. And that probably should be mentioned in his story. It talks more about people, conservative versus surgical management, and it would be fantastic. And again, that's not, Tom Cross's protocol is probably getting the most airplay at the moment, but there are other, bracing protocols. And as that sort of time goes on and we find out exactly what the best, ranges are or things. And at the moment, there is no elite Australian athlete that has gone through that bracing protocol or a similar one yet, but give it a few more years and I think we'll have to put a few of them in the book too. And that would be a great inclusion of lots of surgical, some copers that have survived without their, there's all the recurrences in there too, but then to have a few successful healing stories in there as well. There is a great, her name escapes me, there's a Kiwi rugby player, and she is, I wish I'd probably should have made it not just Australian athletes, but I figured stick in our lane with our healthcare system. But I need some elite Australian athletes to do it, just putting the feelers out there for anybody. And we'll put you in the book.
What happened to the Kiwi athlete? She had a
she's gone through, she's working with Tom Cross and Raj over there in New Zealand, and she's gone through the bracing protocol and is still playing at a bit like Mitch Short's story, unaffected, short recovery time, back fully, her ACL. So Mitch didn't do the bracing protocol, obviously, but he's still healed. Whereas hers, I believe she has, and it's probably healed in the more optimal, rather than a bit of a, as Sharon mentioned, I think when you had her on the show, that Mitch's was a little bit elongated and thin, but clearly still functioning very well. I think this girl's has improved, and again, her name escapes me at the moment, but she's a gun rugby player. That's all I can say. So so it will start to, I think, filter through the different levels at the moment, but it's just very interesting.
It sure is. I always think of the people who've just ruptured their ACL now and how it must be such a bewildering time for them, because, theoretically they could go and see 5 different healthcare professionals and be advised that 5 different treatment pathways was the correct one with them, and every health professional could be extremely confident and in a lot of ways justified in their recommendation. And as we sort of talked about, people tend to be influenced by the power of personality or bedside matter or anecdotal stories or friends' recommendations more than evidence. So if you were sort of going to advise someone, one of our listeners who's recently ruptured their ACL, on what to do and more specifically who they would go and see, what would your recommendations be now?
I think as to who you go to see, it probably depends on where you are in the world. But I think the pathways, you still, if you had, that's the stereotypical, let's say for skiing, you've had your skiing, you felt a pop, you present to your physio or your medical department, you've either had the MRI early or that gets referred later on. I still think that process still sort of has to happen, and then we go, what are we dealing with here? But then we're looking more at that, that stability. Is it a stable knee, even though it's got a rupture? Ideally, I think we'll all get better as people start to be more educated about the classification that Tom's working on. Like, can we start to have a better indication down to our sort of primary care level of going, this one's going to be a good indicator of the bracing or whatever conservative, versus also really important to know which ones aren't. So I think that there's a lot of learning probably and research still to come out from the clinician side so that we can actually more confidently advise. But just having that broad conversation, I think, at the start as well. And, the research is kind of, we should be encouraging at least 3 months sort of rehab beforehand. So sort of, I guess, not pushing for that early surgery unless there's a good reason that client just wants it. And if they do want it, is it because of a time frame that might be their best option for them to pursue that? Or is it because of thought processes that maybe we can provide them with more information to say, you still might go that way, that's totally fine. So I think that's probably the change of just going, don't rush at this point in time, but we're still, the system for how that's all delivered is probably not quite perfect yet either. It'll still be a few moving parts to fall in there, but rather than just that, well, off you go. The surgeon's got a spot for you next week. But again, for some people, that will be the right thing too. So I think that is, still important for us to remember in these conversations, that just where does our person in front of us fit with their needs and wants? We have to educate, but also address what's in front of us too.
Yep. So I guess most people, your advice would be get an MRI, see a physio, and see a doctor and surgeon.
I think, again, depending on where you are in the world, who is around, I still think, you want your diagnosis of what's going on. And as to who the surgeons that you're working with in your area are, as to what their thoughts on all things are too. Like anything, you just want to be referring to your network and all speaking the same language to that poor person in the middle, I think, is the important thing, so that the client isn't receiving mixed messages. So, making sure that, what you say and what the surgeons are saying is in line, rather than contrasting. Does that make sense?
Yes. It is tricky to find people, health professional, a network of healthcare professionals that are all on the same wavelength with such a controversial, I guess, and fast changing injury such as this. But I think that's really good advice. To try and find a network of health professionals who are thinking along the same, work together, exactly, and have that multidisciplinary approach.
And I think that there's some good examples in the book, again, when you kind of go, well, elite athletes should have everything laid on for them, but there are some good examples in there where those networks haven't necessarily been as cohesive as they could have been. And again, when it's the athlete or client, whatever level this is at, if you're getting mixed messages and you're already going through a very physically and psychologically challenging time, to not have a steady support of saying the same things around you can be really difficult to deal with in that psychological kind of realm. So I think that applies for us health professionals need to just make sure that we're all working. Again, you find your team, and then once we have that, we can deliver the service that we need to our clients.
And what are the main factors do you think are going to make somebody more likely to opt for surgery over non-surgical management?
I think again that is still just so client dependent or athlete dependent, and a professional athlete might have a major landmark event where the Olympics only come around once every 4 years, depending on their sport, depending on the level of injury to other structures in their knee. A decision will most likely have to be made quite quickly for them. For someone that doesn't have such time frame constraints, I think again it's like what is their wishes, and again that Mitch Short story is such a good one because he was constantly going, but no, but I feel okay. He was sort of questioning it himself. He didn't sort of have that just acceptance in his head. So again, I think it's so dependent on who's in front of you, and their past experiences. But there's again still that role that we can all play of making sure all information is presented, and then obviously it's up to their choice what they decide will work best for them.
Yeah, and one of the other points that I found really interesting, or one of the many, was from Lydia Lasilla, who talked about how she felt that her knee joint capsule in itself was just a little bit loose and not a super tight knee, if you like. So she really needed her ACL and couldn't have that level of stability that she needed without it. Whereas it seems like just anatomically, there are some people just with a tighter knee joint capsule, and that whole sort of mesh of material that surrounds the knee can, in some people, provide adequate stability without an ACL, but in others it can't. So
absolutely. And I think Lydia's background is a gymnast, so chances are she's got some bendy collagen type. So it comes back to probably partly our genetics too, and also just the injury combination. Again, if we talk about that we've all known the copers versus the non-copers, if we kind of think of it that broadly, that some people just have a greater muscle function, or the way they move, their movement mechanics, they don't load their knee in quite the same way that somebody else does. So yeah, you just have to take it. If someone's knee is collapsing and it's just not appropriate, if they don't mind it, no problem. But if most people that are wanting to be active, if it's just not going the way that they like, then I think that's indication going, well, again, surgery is a great option that for the right people. It's just not the only option.
Yep, for sure. Yeah, it seems that there are a few underlying principles that we're developing consensus on in knee management. And I don't think anyone is saying that no one is ever a good candidate for ACL surgery, the same way people are not saying that not everybody that ruptures their ACL needs surgery. But those principles you talked about is, if you don't have a really pressing time constraint, don't panic early on when your knee feels terrible and painful and swollen in the early stage. That's probably not the best time to make
because every
decision.
injury feels horrible at that acute stage. You sprain your ankle, it feels awful too. And if we told everybody that they needed to have a reconstruction, that's a time when it's obviously going to feel the worst because it's injured, acutely inflamed and injured.
Yep, it certainly seems like it's pointing towards goes through some sort of bracing protocol, of which we don't know, but it seems to be there's some consensus that fully straightening the knee will reduce the chance of ACL healing. The exact angle of flexion is still up for debate, and the pros and cons and level of inconvenience of having your knee bent at 90 degrees for 4 to 6 weeks is still debatable. But yeah, there seems to be goes through some period of range of motion restriction bracing and see how it is at 12 weeks when you come out of that. And if it's still unstable, then that's probably the time to have surgery.
Yeah, and I think again, if we all think it's just basic healing timeframes that we apply to any other region as well, but yeah, for so long we've all just kind of gone, oh no, that's the way it has to happen. So we sort of have maybe not thought about it in the way that we often apply to all other soft tissue injuries. But there's a healing process that has to happen. And if that's not optimal, then we're lucky that we do have a bit of a backup with the ACLs.
Yeah, terrific. All right. Well, that's probably a good note to wind it up, Jess. I really appreciate you coming on, and congratulations again on a terrific book. We look forward to Pop 2 coming out.
Can't promise it'll be anytime super soon, but it will get there. And again, I think the research, it'll be interesting to let that research just roll for a little bit longer, and then come up with hopefully a bigger, more encompassing version of Pop that sort of adds all of this new stuff in as well.
Yeah, so I'd highly recommend anyone who's interested in ACLs, and particularly healthcare professionals with an interest in knees or ACL, as well as the general public, particularly people who have ruptured their ACL and they're trying to work out what to do. This podcast is really aimed towards, to get a copy of Pop and read it. Super interesting and a bit of an emotional roller coaster reading all the different stories. If our listeners wanted to get a copy of Pop, how would they do that, Jess?
Yep, online is probably the easiest way, which is I think how most people buy their books these days. So just Google Pop and it will pop up on all of your major bookstores, and your local bookstore. If they're not carrying it, you can ask them to order it in and they'll order it in for you too. So anywhere where you buy your books, again, if you Google is always the way. Google and it will send you where you need to go. Yep,
such a short, sharp little catchy title. I'm surprised there hadn't been another book with the same name.
The title was thought of before I think I had the title and then knew that I had to write the book. So glad it's resonating with people.
It's one of those questions you always ask. Did you hear anything pop? And as soon as
exactly.
There was a pop. And then everybody nearby says, yeah, I heard that pop too, and standing 5 meters away.
Totally.
You can probably guess what's going on here. All right, Jess. Well, thanks very much for coming on. I really appreciate it, and I hope everybody found it interesting. And that's about all for this week's episode of The Knee Gurus, and we'll be back with another interview on our next episode next week. Thanks very much, Jess.
Thanks for having me.
Bye.
The Knee Gurus, brought to you by Asia Physio, providing world-class physiotherapy care across Asia. Visit our clinics in Tokyo, Singapore, Niseko, Hakuba, Nozawa and Myoko.